The EuroQol Toddler and Infant Populations Questionnaire, or EQ-TIPS, previously known as the TUNDI, is a new outcome measure of health-related quality of life for children aged 0 to 3 years. It is intended to be completed by a proxy, typically the child's parent or primary caregiver. The EQ-TIPS is an experimental EuroQol instrument which is in an early stage of development by the EuroQol Group. The EQ-TIPS is designed to capture the child's health holistically and explores their physical, mental, emotional, and social functioning in an age-appropriate fashion. The current version of the EQ-TIPS was developed in South Africa at the University of Cape Town, but is now undergoing further development internationally. Please scan this QR code if you would like to read more about this initial development. Standardized measures of health, such as the EQ-TIPS, play an increasingly important role in many areas of healthcare research and decision-making, including the assessment of healthcare interventions, measurement of population health, and monitoring the results of routine clinical care. The EQ-TIPS was developed to be similar in format to the EQ5D instruments, such as the EQ5DY, which is widely used in children aged 4 to 18 years, and the EQ5D3L and 5L, which are used in adults. The EQ-TIPS measures health on 6 dimensions: movement, play, pain, relationships, communication, and eating. As development progresses rapidly in infants and toddlers, the dimension wording refers to age-appropriate behavior rather than specific skills. Each of the dimensions are scored on 3 levels of severity. To indicate the health status of the child on the day the questionnaire is completed, the parent or caregiver simply chooses one level in each dimension of the descriptive system. They are also asked to rate the child's overall health on a visual analog scale, or VAS. Instruments or questionnaires that measure health-related quality of life are usually designed to be tailored to a patient's age, which means that throughout their lives, patients will transition between multiple instruments. With the development of the EQ-TIPS, there is potential to measure health from birth to death with EuroQol instruments. As there is a vast difference in development in children under 4 years, the dimensions on the EQ-TIPS and EQ5DY are different. Future research will aim to understand the comparability of results obtained using the 2 instruments. If you would like more information on the EQ5D and EQ5DY, please scan this QR code. Users of the other EuroQol instruments can attach a value or score to each health state generated by their descriptive systems, which is based on the preferences of the general population in a given country or region, and which reflects how good or bad each state is perceived to be. This score is known as the EQ5D or EQ5DY index. The collection of preference weights for all possible EQ5D health states is called a value set. There is potential to create a standard value set for use alongside the EQ-TIPS. Future methodological research will inform whether there is a need for such a preference-based value set, or whether an alternative scoring system would be preferred. The EQ-TIPS is still under development and not yet available for wider use. However, the EQ Office can share experimental versions with researchers who are conducting research which has been approved by the development team. Please contact Janine Verstraete or the EuroQol office if you are interested in using the instrument. Thank you for participating in this research aimed at further development and testing of the EQ-TIPS internationally. Your input will help to develop and refine an instrument that is likely to play an important role in child health research and decision-making.